Okay, Corey Campbell here with Motion Palpation Institute. Brandon asked me to demonstrate a wrist adjustment, more of a mobilization of the carpal tunnel, if anything. There's a recent study that came out that he's going to reference along with this that shows that the area that the carpal tunnel space opens up with manipulation. This was done on a cadaver, so this is the closest thing we have to a cadaver. From a palpation standpoint, in MPI we try to match up adjustments with palpations. Because the wrist is such an osseous structure that's mostly ligamentously stabilized, there's not a lot of joint play in the wrist. So you have to be very stable with your hands. We just joint play back and forth between the carpals, realizing that we're probably palpating a couple different carpals at a time just because of the space that we're going to cover with our hands. Our ultimate goal with most of the wrist adjustments that we do is to increase supination, because we lack that because we're mostly in pronation all day long, and then also open up the carpal tunnel. So we have a couple different options. It's different than what's referenced in the paper. We could mobilize from here in kind of a P to A position. We could also do it here where we actually just take contacts across the hypothenar thenar pads and do a little thrust impulse manipulation this way. Or the one that's probably the best that we can actually open up the carpal tunnel the most is utilizing the speeder board. So I'll just have Jace lay in his back. For demonstration purposes, I'll just rest this on my leg. Typically I'd have it on the table, but so you can see where the hand placement is. This hand just wraps underneath, so my fingers are underneath the wrist at the radial ulnar joint here. We just open up the carpal tunnel the best we can with our hypothenar thenar pads, and then we just do a drop, thrust, open up the carpal tunnel. So we're literally just spreading the carpal tunnel open. We would couple this with probably some myofascial release, because we get really tight through the flexors of the hand and into the forearm, and a lot of times that's what frees up the median nerve, which typically isn't always compressed here, but it's a good study to show that manipulation, mobilization can open up this space. But if you're dealing with carpal tunnel, you need to check the rest of the things in the chain, starting proximally and working your way distally. So that's how we would mobilize the wrist and open up the carpal tunnel as far as the Motion Palpation Institute is concerned.